Hello, everyone. So in this video, I wanted to briefly demonstrate the antithrombotic decision tool where you input the information about your patient so that it can help you to make a decision whether antithrombotic therapy is indicated or not. Since we just had live rounds and we talked about Sophie Errati, who presented for IMHA, I think it would be a good example on how you can use that tool in real life. We're going to choose the species. It was a dog, right? It was I think 5 or 7-year-old Rottweiler. She weighed, to my knowledge, let's say 35 kilograms. Her PCV was 26%. And her platelet count on CBC was 38,000. So I'm going to put 38 here. We also did PT, PGT. They were normal. If you don't have that information, you can just skip it. So you don't have to fill out every single field. And if something important is missing, the tool will give you the prompt and alert. That way you're going to need to fix that issue. For now, we're going to put PT, PDT as normal because that's what she had. We also had access to fibrinogen. Again, if in your hospital you can't measure fibrinogen, that's fine. You can just leave it blank. But in our case, it was 1,000 milligram per deciliter. Again, if you have access to different units, you can switch it over here. And then we did not have D-dimers, or maybe we had them, but I can't remember that information. So we can just skip D-dimers for now. So that was the initial step. With the second step, we're going to assess the risk factors for thrombosis. First, we're going to go over major risk conditions. So this dog was diagnosed with Canine IMHA. There was no PLN, PLE, or heartworm disease. We did not have any evidence of thrombosis yet. And we're going to go on to the next field. So out of major risks, we had only IMHA. There was no cancer, no Cushing's. We did give steroids to this dog. So we're going to click on glucocorticoid administration. And then we're going to go to Virchow's triad factors. There was no evidence of stasis or central line placement, so there was no endothelial disruption to my knowledge, and no previous history of thrombosis. All right, next we're going to move on to the hypercoagulability testing. So if you performed a viscoelastic test or additional coagulation panels, you could choose information from those. For now, let's say you don't have access to it. So we're going to say non-performed. And then go on to the next step. Here is the bleeding risk assessment. So now we provided all information about the clotting risks, but also we need to weigh the bleeding risks against the clotting risks. And we did not have any evidence of GI bleeding on initial presentation. The dog did have a chemosis. So she had a small area of chemosis on the ventral abdomen. And I think that's all here. We did not plan on any surgical procedures. But if for some reason you're planning to do surgery in the next 24 hours, or there's a need for surgery or invasive procedure in the next 24, 40 hours, that's what you're going to choose here. And here we're going to assess the bleeding risks based on coagulation parameters. In our case, PT, PDT were normal, so we're not going to check that. Our platelet count was less than 50,000. And again, we're going to skip the viscoelastic testing for now. So with step number 4, the tool will give you the general recommendation on whether antithrombotic therapy is recommended. And here you can see that antithrombotics are relatively contraindicated. And that's because risk factors for thrombosis present. So the dog does have IMHA, which is a major risk. Normally we would start antithrombotics. But in this case, there are significant bleeding risks that were identified. That was the presence of very low platelet count and a chemosis. Now, there's some exceptions in the real world, right? So this tool is not going to cover 100% of cases. So therefore, there's a note that antithrombotics may still be considered if thrombotic risk is very high, such as in a patient with active thrombosis or IMHA. So you need to weigh risks versus benefits carefully. So again, you can still override that recommendation, but since the risk of bleeding is very high and platelets are less than 50,000, I personally would follow this advice. And again, this tool is made based on my personal experience and the curative guidelines as well as published literature. So for now, again, I'm going to follow this recommendation. I'm not going to start antithrombotics, but I may reassess this patient in the next 24 hours, recheck platelets, and then go from there. Also, in real life, in this specific case, we had access to viscoelastic testing, which also was hypocoagulable, which further supported our decision not to start antithrombotics. And in the next 12 hours, the dog started bleeding in the GI tract. So it was a right decision not to start antithrombotics. But let's say for some reason you decided to override this decision and you still wanted to do antithrombotic therapy. You're going to click here so that you can come up with a specific protocol. You're going to click next. Now, the step number 5 is dual therapy decision, right? Because you have an option. You can start 2 antithrombotics, or you may start just 1 antithrombotic. In this specific scenario, the recommendation is to start monotherapy. So you don't want to combine 2 drugs in this case. And that's because there's single risk factor, only IMHA, and no evidence of active thrombosis. In cases of active thrombosis, when you can see a clot on imaging or physical exam, that would be the main scenario where dual therapy is recommended. Now with the drug selection, you have step number 6. So basically you need to choose one of the 5 options, which are usually available to veterinarians. And these options are clopidogrel, aspirin, rivaroxaban, low molecular weight heparin, such as enoxaparin, deltaparin, and unfractionated heparin. Again, we don't have a lot of evidence to say which option is the best in this specific scenario. I would definitely not choose aspirin, especially if I have access to clopidogrel. So in my personal experience, if I decided to start antithrombotics in this dog, I would use either clopidogrel or rivaroxaban or low molecular weight heparin. So that would be my 3 main options. The unfractionated heparin would be really hard to administer to this patient. It has to be a CRI with a lot of monitoring, and aspirin is just inferior to clopidogrel. Clopidogrel is cheaper and it's oral. Rivaroxaban is more expensive. It's also oral. And then low molecular weight heparin is injection. So if the patient is unstable or you don't trust oral drugs due to concerns for absorptions and things like that, that would be a good option. It also could be expensive for a bigger dog. So I think the probably cheapest option would be clopidogrel. But again, if the dog has platelets of only 40,000 and you're going to inhibit them, probably it is not the best option from that standpoint. And I would probably choose low molecular weight heparin because you can reverse it. So there is a reversal for that drug. And it's relatively short acting, only lasts for 6 to 8 hours. And if this dog were to bleed, I could quickly stop this drug and kind of reverse its effects. Again, just to reiterate, in real life, in this specific case, we did not start antithrombotics, but as a hypothetical scenario, I'm talking about the options here, just to make sure you guys understand that. And then in step number 7, the tool will give you some final recommendations and dosing, depending on the drugs you chose. And since we chose low molecular weight heparin, it will give you the most commonly used doses based on curative guidelines for enoxaparin and deltaparin. In the next step, we're going to provide some recommendations for monitoring, then some information about surgery. If this patient were to go to surgery for some reason and is already on low molecular weight heparin, how do you go about that? And finally, the references. So if you want to triple check everything and go to the primary source, the tool will give you the direct links to the JVAC with all of these domains published in open access. So you can just click on the appropriate domain that you're looking for, and the tool will bring you right there. And then finally, you can print the whole summary of what was recommended. You can save it as PDF or print it as a separate form that will document that information. And again, we're still developing this tool, so there are going to be some bugs. And if you run real cases with this tool, just be cognizant of that. Make sure you understand that this tool was designed for educational purposes only. You can always triple check everything. And if you have any concerns, questions, please provide feedback